We're going to talk about the adherence with glaucoma therapy. There it is. And Anand Mantravadi is the presenter, and here he is to tell you.
Thank you. Well, thanks, everyone. Thanks, Mr. Trimble, for that introduction. And it's a pleasure to be here with you today. I'm really happy to have the opportunity to share some thoughts on this topic of adherence in glaucoma therapy. And I can get into what adherence is. This is a very big and important topic relevant to the treatment of glaucoma and very tied into how people can do with glaucoma. So I'd like to just start off by talking about what we know. You've heard a lot of speakers about some of the pathophysiology of glaucoma and some of the other aspects of it. But just in a bigger picture, what is it that we know about glaucoma? We know that, for the most part, it's a silent condition. We know that this is a chronic disease. And we know that, untreated, this is a blinding disorder, that it is the world's commonest cause of irreversible blindness. But we do know that it is a very treatable condition and a very manageable condition. So that being said, glaucoma is like many other chronic diseases that you know about, hypertension being one of them. You know, chronic diseases have a lot of problems associated with them. They offer very little reminders in terms of their presence. For example, it's not like a sore throat that will constantly remind you that there's something going on. And so therefore, the benefits of taking a medication for something that is silent might not necessarily be immediately realized. You might not realize that by taking something today on a regular basis, it might help you years and years down the road. And so the idea of taking something lifelong also for a chronic disease is something that I think is a very just difficult concept to swallow. I mean, it's a difficult thing to realize, especially when you're first understanding the role of medicines in glaucoma as a lifelong therapy. So with that, let me just talk about what is adherence. What does the word adherence mean? Adherence is just really another word for compliance. And some of those in the corporate world might be very familiar with the term compliance. But what compliance really is, and adherence is probably a better term for it, is the degree to which a patient follows a prescribed treatment regimen during a defined period of time. So during a period of time, how much does one adhere to that therapy, to their prescribed regimen? When we look at glaucoma specifically, it is clear that having substandard or poor adherence or compliance with therapy over the course of time can lead to worsening of disease. And that's been shown not only for glaucoma, but for some of the other more chronic diseases such as diabetes and hypertension. So non-adherence or decreased adherence really represents a major problem in this silent chronic disease that really heavily depends on taking medications for the course of their treatment. So I would like to talk about several things here. If non-adherence is a major obstacle in glaucoma, how do we detect it? And then once you do detect it, how do we understand what are some of the barriers of adherence? And then after finding out what are the barriers of adherence, what are steps that can be taken to improve adherence? So let's start off by detecting and measuring adherence. And I'd like to talk about this on two different scales. The first is the individual scale, when you're sitting with your doctor in the office. And then the second is from a more global perspective, from a population-based perspective. From a personal standpoint, when you're sitting with your physician, you know, clearly the doctor-patient-physician relationship is paramount. I mean, this hinges on trust. And so understanding if someone is having difficulty taking medication, if forgetting medications over a period of time is an issue, really hinges on that sort of trust that's central to the relationship between a doctor and a patient. But as everyone knows, you know, the relationship between a doctor and a patient can inherently be sort of paternalistic. There are instructions that are given to someone, and someone is expected to try to follow them to help their condition. And so there are descriptions of patterns of medication use that might result from that type of relationship. One being cyclical. Cyclical medication use being that, say, for example, you take medications for a little while, time lapses, you know, this is a disease that doesn't remind you of its presence, some time goes by, you know there's a doctor's appointment coming up, and then all of a sudden medications are restarted. So that type of medication pattern is called cyclical medication use. So that is something that's very commonplace in glaucoma therapy. And from a physician standpoint, you know, we're not great detectives, frankly. You know, doctors really do not detect adherence very well. In fact, about a fifth of people who are non-adherent are entirely undetectable to a doctor. And so this brings us to a very common scenario, one that presents itself very commonly in glaucoma care, which is if someone seems to be changing, if their disease seems to be changing, the question will often arise, you know, is it changing because the medications are being used but the disease is still changing despite that use? Or is it changing because perhaps there's some lapses in treatment for whatever reason? Maybe there's some periods of time where they're unable to take the medications, and as a consequence, maybe the intraocular pressure is elevating and causing some progression of their disease. So this is a very common scenario, a very common clinical challenge, and one that presents itself daily to clinicians. So taking a larger step backwards, how about looking at a population? How do you measure adherence for a population? How do we know, looking at a group of people, what is the rate of people taking a medication for a defined period of time? If you have 100 people, what percentage of them are taking their medication as prescribed for a period of time? Well, we can rely on, when we try to study this matter, three kind of separate ways. The first is self-reports. Self-reports are something that many of you might have participated in some of the trials that we might have going on here at Wills. But they might include people who fill out surveys, you know, say I've taken my medication at X, Y, and Z time. But clearly that is subject to maybe some biases. You know, I certainly can't remember if I took a vitamin 2 days ago, so that might be, you know, subject to recall bias, or the hinges on remembering whether or not I took the medication. And it might actually overestimate adherence for that population. The second is devices that you might have seen. There are small devices that some companies manufacture. You could have put a bottle of medicine in it, and as you dose it, it electronically registers how much of that, you know, how many drops were instilled. And that's also a way to measure adherence for a group of people. However, the dosing aids might not be able to clearly tell if the drop actually got in the eye. So it might register that drops are being instilled, but it doesn't register whether the drop actually hit the eye and was absorbed as it should be. Then finally is something called the medication possession ratio. This is sort of a number that can be derived by looking at large databases of claims, of Medicare claims or insurance claims, to look at how much medicines are in a patient's possession for a certain period of time. And that can derive a number and can kind of reflect as a surrogate marker perhaps how much compliance there is for that group of people. But this doesn't really account for many samples that are given in your doctor's office. It might not account for if your doctor has switched your medication. So clearly there's a lot of difficulties when we look at a population to estimate how many people are taking their medication for that period of time. So those are some of the ways to measure adherence. Let's talk about something that's perhaps of greatest relevance, which is what are some of the barriers to adherence? What are some of the things that prevent people from taking their medications for a defined period of time? Using a prospective interviews with a group of patients, one study was able to group this into four major categories. The first is environmental and situational, and this might be something that many people relate to that are taking medications on a regular basis. These are sort of social circumstances that affect people's ability to take medication regularly. You know, people are busy, they travel, they might forget their medications. If there's a major life event that had occurred, maybe that might create a lapse in taking therapy, maybe perhaps a lack of support around home. You know, these are all things that are very real that affect people's ability to take medication on a regular basis. Medication regimen factors. You know, clearly costs of medications are high It's an issue that's ongoing. It's not an issue that'll go away, I don't think, in the near future. Dosing frequencies, complex schedules, the ability to actually instill the medication. These are sorts of issues that might be related to the medication themselves that might affect someone's ability to take their medication as prescribed for a defined period of time. Some patient-related factors, it's sometimes hard to put it in dexterously. I mean, with the bottles, so that might be an issue. The financial circumstances. And this next topic, the health literacy, this is something that I find is very relevant, which is one of the things that's been associated with people's decreased ability to take medications over time is hearing everything one has to know about glaucoma from their doctor. In other words, if, as a patient, we rely on our doctors to tell us everything there is to know about the disease during that brief encounter that you see your doctor, that's been shown to have an effect on people's taking medication over a period of time. In other words, people tend to take medication less frequently if the only information they're getting is from their doctor during a brief visit. So there's a lot of other educational information and resources that can be used to enhance your education, but if you rely solely on that, 15, 20-minute encounter with your physician, then that tends to affect people's adherence over time, and that's been kind of shown in the literature, and we'll go over some of the ways to address that. And then certainly other health problems can also affect people's adherence over time. And then finally, the last category is provider-related factors related to the patient-physician relationship, as I talked about. Certainly hinges on trust, but maybe there are some factors in that relationship that might affect one's ability to take their medication over time. So those are some of the barriers to adherence that have been identified when we look at populations of people. And once those barriers are examined, then what are some of the steps that can improve adherence? And clearly, this is a complex problem, and that is not very easily generalizable over a population. For example, why someone might not take a medication can be a very different reason than why someone else might not take a medication. And these are problems that span all socioeconomic statuses and span all ethnicities and both genders. So clearly, this is a very complex problem that would require a multifactorial solution as well. When we talk about improving adherence, one of the first things we can talk about is improving the patient-physician dialogue. So there are communication strategies that have been reported that might enhance someone's understanding of how important it is to take medications. And there are some interview strategies that have been reported that might enhance that. But I think of paramount importance is the next topic, which is educational strategies. As I alluded to earlier, if people really rely on that short encounter with a doctor to learn everything there is to know about glaucoma, that might negatively affect their compliance and adherence over time. So really taking advantage of a lot of the resources that are available to help enhance one's education, such as internet resources, videos, reinforcement of the knowledge of the disease, can be very helpful in terms of understanding why it is these medications are important and how taking it today might help you, several years down the road. This is next topic, something that Dr. Spaeth and I have talked about, and he is a big proponent of this, which is patients as active participants in their own health. And so, really understanding your own condition. Dr. Spaeth had mentioned to me at one point that people who bring in personal health summaries, he found to be very helpful in terms of diffusing the information that is necessary to make proper decisions for that individual. And it demonstrates several things. It demonstrates also that as an individual, by bringing in a summary, that perhaps I'm taking a responsibility in my own health care. I'm trying to become an active participant in my own health care. And it helps to sort of relay information and also makes that individual more responsible for their own health. So, clearly that's a nice strategy by which patients can help their own care. It's clear that patients who participate in their own health care do better. That's clear. And then employing some support systems, family, friends, to help enhance people's ability to take medication is also very helpful. So in summary, greater adherence or greater compliance with medical therapy will certainly lead to better patient outcomes. And this is a very big topic these days in not only glaucoma but in other chronic diseases, as I've mentioned before, like hypertension. And to specifically find ways to address this on multiple levels, whether it's improving communication, improving education, empowering patients to take charge of their own health, whatever it is, finding ways to address this issue is a challenge, but it does have tremendous potential to make a difference. With that, I can conclude. Any questions on this topic, I'd be happy to answer.